For Jess, motherhood has been a painful journey as well as a joyful one.
Let's get one of your brother's books, shall we?
6-month-old Eli is her second son. His brother Leo died just before he was due to be born.
You go home knowing that the next thing that you need to do is go back to the hospital and give birth to your dead baby. There's no sugarcoating that. That is what is happening.
Currently, coroners don't routinely investigate a stillbirth like Leo's. But today, the Health Secretary announced he's looking to change that policy.
So when it comes to maternity safety...
And he unveiled plans for deaths and serious injuries during childbirth to be investigated far more thoroughly.
The job of those investigators isn't just going to be to tell the parents much more quickly what happened from an independent viewpoint, but also to spread the learning from what went wrong, so that hopefully if something goes wrong in the West Country, they'll find out about it in Manchester the next week, not 10 years later.
An analysis published today estimates 80% of babies who die as they are delivered are victims of poor care. Staff shortages and heavy workload, plus inadequate monitoring during labour and poor staff judgment were all contributing factors.
I think everyone would agree that the NHS at the present time is overstretched and under-resourced, and maternity is no exception to that. So together with the Royal College of Midwives, the RCOG are calling for more midwifery staff and more obstetric staff so that we can improve outcomes for mothers and babies.
An independent expert assessed Leo's death ahead of Eli's birth.
That was very important for us to rebuild that trust. It wasn't necessarily that the hospital had done anything wrong in Leo's death, but you lose trust in the world when your baby dies. Leo has died, nothing's going to change that. So for us, it's what can we contribute?
From now on, more bereaved parents will get the answers they need, and the health service should get better at ensuring death before and during birth doesn't happen so often. Catherine Jones, 5 News.